I think we can go ahead and get started if you guys are ready to go.
Sure.
All right. So thank you guys for coming, for all the people that have joined in from your busy schedules. I know it's kind of hard at 10 a.m. on a Wednesday, but I appreciate it. My name is Victoria Doda. I'm a marketing associate at DTC. And for those of you that don't know what DTC is, we are a tech company and we're an MSP, a service provider. We mainly focus on dental offices, but we do medical and really any other. We're expanding into other industries. So I'm sure that the people coming onto this are going to be for dental because it's for dental practice transitions. And then just for future reference, so you guys know, we will be hosting webinars once a month. And after this, because you have registered for this one, you'll get notifications of the next ones, and hopefully you'll be able to join us again. But I would like to thank Tom and Curt from MidAtlantic Transitions to being here today. It's really great to help us kick off our 2021 webinar series. So thank you both. And Tom has a history. He used to be a dentist. He was over 25 years in practice, and then he opened up this company. And then Curt has a few years of experience with the dental industry as well. So they know their stuff, they know what they're talking about, and they have a lot of great information to share with you guys. So I'm going to pass it on over to them. So Tom and Curt, you guys can take it away.
Thanks, Victoria. I appreciate you introducing us. And I know the DTC very well myself because I know the owner, Steve, and Steve has been doing this for a really long time and has a lot of experience in this field. So I'm honored that he invited us to kick off your webinar series because I know you guys were doing this at one time. So I've been doing this for about 8 years. I sold my practice in 2011, started doing this in 2012. Helping either buyers or sellers with practice transitions, and I get a lot of satisfaction out of helping other dentists get to their either retirement or get to owning a practice. So let's try to get into some information. And Curt's been working with me for a year. He was working for another firm doing the same thing. So Curt has a lot of background in dental practice transitions as well. If anyone has a question as we go along, please just put it up on the chat. We're happy to answer anything we can answer, but basically we wanted to talk about what's going on in the transition world with COVID, and because it's obviously a crazy time, I hope everybody is safe and healthy and getting through a very odd and crazy time. So if you go to the first slide, Victoria, I'll get started. So the obvious question that a lot of people have is, are practices selling during the pandemic? And the answer is they absolutely are selling during the pandemic. Matter of fact, last year was the busiest year that we've ever had since we've been doing this. And that's sort of for a few reasons. There were people that, because of COVID, wanted to get out of dentistry altogether because they just didn't want to deal with it. So it actually created a much busier time than even normal. Normally we're selling 20 to 25 practices a year. Last year we sold 27 practices. So it is a really busy time. So if you're looking to buy or you're looking to sell, it's an active time to do that. So next slide would be good. So there were basically different types of seller situations that we've been dealing with. The one situation I alluded to is, I had people call me and basically say, Tom, I just don't want to deal with COVID. I don't even want to go back into the office. This was in March. So we had to deal with those practice sales in such a way that it was as if somebody was disabled or had passed away. So there were a lot of sales that we had to, get through pretty quickly. So that was one situation. Another situation was we had sellers that we already had letters of intent on, and we were working through situation, and then COVID hit, and we had to deal with getting those people through the transition, which we did. And then the third situation is people that began selling actually during COVID. And again, it was a matter of getting, the transition to work its way through. So there were three different ways that we were dealing with seller situations in 2020 and now. So next one's good. This is a question that I'm getting from a lot of people. A lot of sellers or potential sellers will call me and say, how are practices being valued, with everything going on, and obviously business being down because you were shut down for a couple of months in 2020, how are practices being valued? And basically the way practices are being valued is the banks, as well as us, are comparing month-to-month production and collection relative to 2019. So we'll look at the months when you're fully open, which in 2020, that was January, February, March, April, May, whatever months you were shut down and not allowed to be open full time, sort of get thrown out. And then we look at the months once you open, and we compare those months to the months in 2019. If your production / collection is within 85% of what you were doing in 2019, basically the practices are being valued at the same value they would have been in 2019. If the production / collection is a lot less than 85%, then that changes things, and the value would be less. So again, we're just comparing months to what the months were in 2019. And as long as you were doing 85% or better in the months where you were fully open, it really doesn't affect your value. And this is an important thing for sellers to know. And it's also an important thing for buyers to know, so that they don't have expectations of, either a lower value or a higher value. Curt, feel free to chime in on anything as I talk, and if anything else you want to add. Yeah. So, okay, next slide's good. So I alluded to this in the slide before. How has the pandemic hurt practice values? Well, it depends. If your practice is doing 85% or better in the months that you are allowed to be open full time, it hasn't affected value at all. And I think that's the misconception. People think that because numbers are down for the full year, it has affected value. The full year numbers in effect for 2020 are going to get thrown out the window. I mean, they're just not going to be relevant, because you can't use full year numbers when you can't work for a couple of months or 2.5 months. So it hasn't affected values for most of the practices that we're dealing with right now. So what are the seller's options, and should a seller wait to sell the practice? Being a dentist myself, selling a practice is about a lot of things. It really shouldn't be completely about the money. When you're selling a practice, you're selling a practice because you want to be done practicing, or you want to give up ownership and work as an employee. If you're asking, whether you should wait or not based on the valuation, that's a different question. So if in your situation, the numbers are down in the months that you're open full time and you're not going to get full value, and you want to get full value, then you probably would have to continue to work and get your numbers back to where they were, or at least within 85% of where they were before, to get the same value. If it doesn't matter, if you're willing to take a lower amount for your practice based on what you're doing currently, then that's a different story. Again, selling is about money, but it's also about, are you ready to be done? You need to be done. Do you want to give up ownership? These are all questions that are important to ask. So being an owner, it's your choice, and the ball's in your court. You can do whatever you want to do. I never want to have a dentist sell a practice before he or she is ready to sell a practice. It's more about whether you're ready to give up ownership or stop practicing. So, how are sellers doing financially post-COVID opening? It's interesting because having 25 practices for sale at any one time, we do get to compare different practices. And for the most part, in most areas, people are at that 85% or greater level than they were before. There are some practices in some areas where they haven't bounced back to where they were before. And we try to figure out why that is. Is it a political thing? Is it a more conservative area versus a more liberal area? Is it a more elderly patient demographic, a younger patient demographic? Is it, it's hard to know exactly what the reason is. Is it because it's fee for service versus a PPO practice? But for the most part, I would say the vast majority, probably 80 to 90%. I don't know what you think, Curt. Probably 80 to 90%, even greater. The practices that we have are back to where they were.
Yep.
What do you think, Curt?
Are at that level. And of course, we have some that are not, but
Right.
again, it depends on when they opened, and what Tom referenced a moment ago, lots of factors on why patients are coming back to offices or not. And pinpoint any specific piece other than said it could be demographic.
Yeah, the one practice I think of is
Closer to their office.
Yeah, the one practice that comes to my mind, which you probably know who I'm thinking of, or it's a fee for service practice, and it's a very liberal area. So whether that means that people are more afraid to come in, who knows? Maybe because it's fee for service and people lost jobs and they're paying out of pocket. They don't have insurance. The numbers are down for that reason. And there's a slide that talks about this, but another reason this particular practice is down is because they lost a hygienist or two. And once you lose one of your producers, then obviously your numbers are going to be down because you don't have the same number of producers that you had in your practice before. So that's an obvious reason why some offices are down more than others. So what are the different types of transactions that are occurring? It's with practice transitions, there's always a few different types of transactions. The slide really is more indicating, are we still doing mergers? Are we still doing straight out practice sales? All these types of transactions are still occurring. It's not like because COVID is here, something off the table and nothing is happening like it was before. The value of the practices are being affected to a minor extent based on what the numbers are, but the transactions that would normally occur are still occurring. It's nothing different. Somebody was asking me, are holdbacks necessary during this time? Meaning, are the banks holding back some money based on revenue because the numbers are down a little bit? And this goes back to the same thing we were talking about before. The answer is we were involved in 27 practice sales last year. There was not one deal that involved a holdback, not one. Meaning, if the practices were doing 85% or more, it was a regular kind of practice sale with the normal value. If it was less than 85%, then you had to talk about the price based on where you were, but we weren't doing any holdbacks on any particular deals last year. And I don't see us needing to do holdbacks. Normally holdbacks are done when there's some uncertainty or, the buyer or the seller can't be sure what's going to happen moving forward. Now, hopefully there's more certainty now than there was in March, but with everything going on, obviously the pandemic is not good right now, but the vaccines will hopefully catch up within 2, 3, 4 months. Who knows? Everything is starting to get better. We can all hope. So, okay. Curt, all you.
So good morning and thank you. So we haven't figured it out yet. You'll see there's a common kind of thread here. Nothing's very different prior to COVID. While there are more challenges and it's harder to get to where we need to get in some instances, nothing's really changed. So are buyers active at this time? They're as active as they were in January and February of last year and all of last year. So we've been very busy, as Thomas said. We have doctors, range of practices they're looking at, or anywhere from, the smaller practices where we do a merger or a chart sale, or a small practice where we sell the practice outright, all the way up to multi-million-dollar sales. So we have all of those things that occurred in 2020, and a number we couldn't in 2020 that are closing this month. So short answer, are buyers active? They're very, very active. They're checking not just with other folks as well, but our phones are ringing all the time, and we're continuously of offices and listing offices as well on a regular basis. Next slide, please.
And Curt, you are kind of echoey, so I'm not sure if Tom, maybe if you mute yours, it might be hearing it. That might be the echo that we're getting. So if you want to mute your mic.
Okay.
I'll talk slower, maybe that helps. So what are the buyer's options? So thank you. What are buyer's options? So the buyer's options today, again, are no different. So banks are up and running. All the banks are lending. When we began, the shutdown back in May, there were only a handful of banks at the time that were lending. We'll talk about this in a few moments, and Tom has referenced it. But as long as the practice has rebounded to a certain level is 80 to 85% of last year's collections relative to the same period. The buyer's
I think
option.
you're cutting out a little bit, Curt. Is that happening for you, Tom?
Yeah, do you hear me right now, Victoria?
Yes.
All right, maybe I don't know how to mute my, I thought I muted my microphone, but maybe I didn't.
It's okay.
If you tell me how to do that real quick, I'll mute mine just to see if it helps.
It's on the bottom left-hand side of your screen. You should see a little gear, and it says settings.
Yep.
And then you click on that. And then where your microphone is, there's a little slider with a little circle. And if you turn that, it'll turn it off.
Oh, I sure don't see that.
Okay, can you hear me now?
Yes.
You still hear me?
Yes.
Yes, sir.
If you highlight over yourself in your video, the microphone pops up also. So you should be able just to click that and it will mute it.
Got it.
Talk now.
I'll try. So how am I doing? So anyway, the options for buy are 100% back with all banks for lending. There's no impediments to a buyer buying a practice now, other than their actual ability to buy a practice pre or post COVID. So no changes there as far as what buyers' options are. Should buyers be buying? Absolutely yes, as long as they're qualified and the banks, the practice, is up and running and in good financial shape. there's no reason not to buy now. When you look at interest rates, the interest rates today are lower than they were going into COVID, when COVID began. So if you look at January and February last year, the rates were in the fours. We're rates now in the high twos, low threes from most of the banks, and they're all very, very competitive. So the banks are going after this as well. So for a buyer, it's a perfect time. Banks are anxious to see you, and we have a number of doctors, whether it be ready to retire, because it's their time, or because they're ready to retire because they don't. So it's a great time to buy doctors. Buyers begin differently during this period. We don't think that the practice values are going to be on the practice economics. So is the practice up and running? Is the practice doing well? And are the patients back? And if all those things are in place, there's no reason to negotiate differently. I will tell you that we are some folks, and not all, are going to come in low, whether it be the buyers or the buyer's representative, and they're really just testing the waters. For our part, if a practice is deemed that it should be sold at a discount, we will have talked to the seller about that and discussed that and decided, as Tom said, do we wait 6 months and let it catch up, or do we go now? However, we're still getting those low offers. Then we could say, look, this practice is in perfectly great shape, and there's no reason in the world we shouldn't be at the valuation where we are. Are they negotiating differently? Some are, most not. Should they be? They shouldn't be. They're looking at the practice values just like they would have looked at them a year ago. Next page, Victoria. Why are some practices being affected more than others? So Tom talked about this. One of the big things we saw was the return of staff to the office. That one practice for the state where he had 2 hygienists, neither hygienist returned, period. He had a very, very hard finding hygiene, even finding temporary hygiene. Most all of us had that same situation. Temporary hygiene wasn't available, and hygienists and assistants as a whole just weren't getting back to the offices as quick as the doctors. So, when you're not, when the doctor's doing hygiene, obviously we're diminishing the economic impact of the office. So that to me was the as we came out of not out of COVID, came out and began to reopen our offices, began to work again, was didn't have the staff, you couldn't get the up needed to be for the banks to finance. So to me, that was the biggest part. Doctors that saw emergencies during closing, when practices were closed, in a big up. We're not in general. Doctors we work with saw a good uptick because when those emergency patients, those patients then came back to them as patients after the fact. And then reopening. When did you reopen? Were you cautious and reopened later in May, or did you open right away in May, get started? So your June, July, and August were. So I think those are the 3 biggest affecting reopenings. And Tom, jump in if you like, but I really believe the staff piece was really slowed down the process initially more than anything. Next page, please. As buyer pools got smaller or larger for sellers. In fact, I don't really see a difference. We were very, very busy last year, and as Tom referenced, we were very busy this year. We're getting as many calls and showing as many offices and practices as we ever did. So if you ask me, there's a larger buyer pool, and I think that's been impacted by associates that are not getting the hours they had at the offices where they were prior to COVID, the impact of COVID. And so their income has dropped. So they're looking at it and saying, I'm going to buy next year. Now I'll look this year because I'm making 25% less than I was making a year ago because those patients aren't coming our way, or I'm not getting them in the office. So buyer pool, I think, has gotten slightly larger.
And then Curt, I think the echoing is just kind of getting worse. So I just wanted to mention that to you. So I'm not sure if maybe you are closer.
Maybe I don't know. I'll try to talk slower. Does that help?
I don't
anyway,
think so.
I've only got
Tom,
two slides left. Tom, you want to take them?
Yeah, go ahead to the next slide. Can you hear me, Victoria?
Yes.
Yeah.
Yeah. Is it a buyer's market or seller's market? And change in that, really good practices are selling very quickly. We've had a number of top practices that we listed and sold and closed in 2 to 3 months. Challenging practices were always challenging practices. Longer. It takes us time to find a buyer, and it takes us to find the right buyer to identify that practice and see the practicality of purchasing the practice and potential for growth. Is it a buyer market? I don't see it being vastly different than it was before. I think it's always a seller and buyer. And Tom, do you have a thought on that?
Yeah, so I would say that, getting back to the slide before, there are slightly more buyers now than there were before. I think because some people, their time got cut back as an associate, and then they just figured, well, this might be a good time to start looking for a practice because, I'm not getting as much work as I had at the office where I had. So as Curt said, since I've been doing this, nothing has changed in that the very best practices sell very quickly, and the ones that are not as desirable to buyers take longer to sell. The fact that there's more buyers now than there were before in one way makes it even a little more of a seller's market, I think, right now than it was. But it's not a big difference. So. We lost Curt for the moment. I think this was my slide anyway. So it's a good timing. It's my time to hop in. So how will the pandemic affect the practice short and long term? I think we're all hoping that things will get back to semi-normal, meaning we're not going to have to deal with all the things that we're dealing with. I'm hearing a lot of noise in the back. Are you hearing that, Victoria?
I think it just Curt's reconnecting and cutting in and cutting out.
Okay. So definitely we're being affected in the short term. Definitely be affecting in the short term with cost of PPP and patients not coming in because they're afraid. And long term, I don't think there's going to be much of effect at all. That's just my personal opinion. After we get through, I don't know, the next 9 months, 6-9 months, we'll see what happens. So,
so how are banks?
How are the banks? Yeah.
Go ahead, Tom.
Yep. Go ahead, Curt. I'll let you take. You want to take this one? I think you were taking this one before.
Yeah, I was. So earlier, 2020 is a wash. Spoke to a number of banks over the last several days just to confirm you so far. So 2020 will be a wash. As Tom said, we're going to look at January, February, and then the months are open to see if there's been a recovery up to 80 to 85% to where it was last year. So August 2019 is at 100,000, and August 2020 is at $80,000. They're going to be fine. Now, moving into 2021, I was told by our banks yesterday was it'll be similar to that process. They'll look at 2019 and they're going to look at or in 2021 6-month trailing numbers. Those trailing comparison numbers for 19, 20, and 21, but 6-month trailing. All of the major banks, in fact, every bank is lending. Happening right now. Some of the banks with you have a straight loan, you have a startup to start a practice from scratch, and you have what they call a jump start, and that's when a practice is for sale. They've been open for a short time. It hasn't really hit their goals, financial goals where they should be, and they're moving on. Bank of America is a primary financer of jump starts, and they're not going to begin that until the second quarter next year, or 2021. I'm sorry, this year. That said, all the banks have begun lending again for startups, and all the banks are lending for regular, just a regular everyday purchase. So just again, 2021 will be where we are with almost all of the banks, and again, looking at those numbers the years prior. But everybody's open and ready to lend. Tom?
Yeah, let me jump in, Curt, because we're really having a hard time with the, at least for me, it's sort of tough to hear. Yeah, let me comment on the banks real quick before we go to the next slide. Some banks during COVID, as Curt was saying, I believe, were really shut down and really weren't as active as they normally would be with practice transitions. And other ones really did pick up the slack, whereas under normal circumstances, everybody would have been in play. That the number of banks that were in play with practice transitions sort of shrank. So it was really important to know which banks were active and which banks were not active. So you didn't waste time dealing with banks that really weren't dealing with it because they were dealing with all the loans out there that they were dealing with. So hopefully all the banks are going to get back into it just like they were before, although now that they're going to have a second round of the PPP loans, some of the banks are going to be busy with that again. So I have a feeling it's going to slow down certain banks. Anyway, next slide would be good. Are the banks requiring other information during the pandemic? We already hit on this. Under normal circumstances, when we are selling a practice, we're looking at full year tax returns and full year profit and loss statements. Because of COVID, we are literally looking at individual month profit and loss statements, individual month production/collection reports. So that is a big difference as far as what they are asking for. They also have a questionnaire asking the sellers, how are you reacting to COVID? Are you open? Are you taking precautions? So the banks are asking for more information from the sellers, more detailed information, more specific information, but it really hasn't slowed down the process of the practices selling. So next would be good. The expenses of the dental practice, of course, with all the personal protection equipment costs, that is, I've heard from some of my fellow dentists how expensive some of this stuff is, depending on what it is and where you're getting it from. That obviously is having an effect short term on the cost of N95 masks and some of the things that different offices are using as far as the evacuation systems and air purifiers and everything else that a lot of the offices are trying to implement that are atypical for what a normal dental office was would be. So it's definitely affected expenses in the short term. But again, I think over the long term, some of those things are going to go away. The employees, what happened in effect when COVID hit? What I found, and Curt can verify this with some of the other practices, some people that were working, I mentioned I had some dentists call me and say, I'm not even going back to work. I don't, either I have health issues or my spouse or partner has health issues, and I don't want to expose them to any possible COVID infections, and I'm not going to go back to work. For the same reason, this affected employees. There were hygienists that were working as a hygienist because they enjoyed being a hygienist, but maybe financially they didn't even need to work. Their spouse was working, they were getting up in years and they were doing this as something to do. So it really did affect a lot of offices with losing hygienists, losing dental assistants, losing front desk people because they did not want to deal with the possibility of getting sick or one of their significant others getting sick. So this was a big issue. There was a shortage of hygienists and assistants, and for that reason, the cost of supply and demand, the hygienists were asking for more money, the assistants were asking more money, and anybody that listens to this that's a practicing dentist knows that that's the case. So if you're fortunate enough to retain your entire office staff during COVID, then you're fortunate. So it's interesting. What are the selling practices doing regarding PPE? And I see all different levels of what they're doing. I see people using the evacuation machines in every operatory. I see air purifiers. I see people hooking up things to the HVAC, putting stuff into the air. I see people, obviously using the higher N95 or KN95 masks. I see a wide range of what offices are doing. Of course, we're very, infection control minded to begin with. A lot of people are having the patients wait in the parking lot and they're texting them, so there aren't that many people in the offices. They're spreading out their appointments so that, again, they have more time to fog down the rooms or have people getting out of the office so there's not as much overlap. They're getting rid of some chairs in the waiting rooms. There's all different ways you can remedy and protect yourself. So, of course, now, fortunately, with the vaccine, people are starting to get vaccinated, and that's huge. I've talked to a number of people that have gotten vaccinated or are scheduled to get vaccinated. So it's moving in the right direction. Okay. So the sales contracts, because we're always dealing with the attorneys and contracts, they are putting more COVID-related wording in the contracts. The practice has to be doing at least 85% of what it was doing before to have the same value. You have to be using the right, PPE in your office. So there is wording that is new to some of the sales contracts because of COVID, which makes sense. So how has the pandemic affected DSO sales? And a little background here. I started helping some sellers that wanted to sell to DSOs for different reasons. One of the reasons is people wanted to sell to a DSO so that they could sell and still stay there as an employee, which DSOs want sellers to stay. And for them, it might have been a good fit, or the fact that they were offering a lot more money than an individual buyer if it was a profitable practice was another reason. But during COVID, I sold 27 practices. We sold 27 practices last year. I only sold one practice to a DSO, which being a dentist always makes me happy. But relative to other years, the last few years, we were selling a few more practices to DSOs. To answer the question, from my perspective, not that I'm dealing with all the DSOs, because I do have a few practices that a DSO might be interested in. They quieted down a little bit during COVID because they had so many offices to deal with. Can you imagine, the private practitioners that are watching this? You're dealing with one office where you're losing employees. You're dealing with the new PPE. Can you imagine having a lot of those kind of offices to deal with? I think they were just so overwhelmed that they sort of slowed down and shut down for a while as far as looking for new offices to sell. I sort of sense now they're starting to pick up a little more. Not that everybody shut down. There's some of the DSOs are always looking and they're always doing startups, but for a lot of them, they slowed down during the pandemic. And my sense is they'll start picking up again. So how to prepare to sell a practice during this time? It really isn't any different. The same theme that we've had before. We want to plan as far ahead of time as possible. And I know that's tough for some of those dentists out there. More than often, I get a phone call from somebody and they say, Tom, I'm done. Just, sell the practice and get me out of here. So they want to sell it pretty fast instead of meeting 2 or 3 or 4 years ahead of time and preparing and knowing how to set up your practice so that you can get the most value and how to deal with employees and your tax returns, et cetera. But no different than any other time. You just want to make sure that you're in a good position to sell like you would normally be. So buying a practice, I guess what I would say at this point is you're going to do your due diligence just like you would any other time. And you're going to look at month-to-month reports too, because ultimately that's what the bank is going to look at. And you want to make sure that practices are bouncing back, or at least 85% of what they were before. But you're going to do all the same due diligence that you normally would do. When I'm helping a buyer evaluate a practice for sale, I'm looking at tax returns, I'm looking at software reports to look at production, collection, what procedures are being done, what the office is like, the demographics, what the equipment is like. So you're going to look at all the same things, but you have to dig a little more month to month to make sure that things are bouncing back. There are some practices, like we said, that are slower for whatever reason. You just don't want to you want to make sure you've got a practice that is bouncing back. And if it's not, then, if you're still interested in that practice, you should offer less than what the established value is. As far as being ready to buy a practice, I've said this many times in buyer lectures. Any buyer during any time, whether you're buying during COVID or not, you want to be ready clinically, you want to be ready communication-wise, personally, you want to be able to communicate well, and you want to have some sense of running a business. I think it's impossible to know all the ins and outs business-wise until you get into it. I didn't know all the ins and outs before I did my startup. But you have to have a sense of how you want to run things. And typically, if you're working at different offices as an associate, try to learn as much as you can. And I don't only mean clinically, I mean, go up to the front desk, see what they're doing, see how they're talking to patients, see how they're dealing with insurance, see how they're scheduling. All those things you want to have as much of a background in as possible. I said earlier, you should never sell before you're ready to sell. Well, you should never buy before you're ready to buy. And if that means you're an associate for 2 years, fine. If it means you're an associate for 5 years, fine. But you have to know yourself and what you're good at, what you're not good at, and decide when the timing is right for you. So, okay.
Very good.
Yeah. So is it a good time to sell? If the question is really asking, is it a good time to sell from a value standpoint? The answer is yes, because values haven't been affected, as we've said many times already, unless your numbers are down. Is it a good time to buy a practice? Again, it's a good time to buy a practice if it's the right practice for you and you're ready to buy and you don't want to be an associate anymore and you want to make more money, then buying a practice, it's the right time to buy a practice. As a practice owner, you're obviously not going to buy a practice where you're going to make less money and have all the added responsibilities that you do as an owner. It doesn't make sense. So you want to buy a practice that you can make more money right away, or have the potential to make more money because you can add services or do some things that are obvious that can make that practice more profitable. So it's a good time to sell if you want to sell, and it's a good time to buy if you're ready. So, questions? I don't see any questions in the chat box. I don't know how many people are actually watching.
Yeah, we have a few people watching, but I'm not sure. So if any of you guys have any questions right now, the floor is open. So go ahead and put them in the chat. And then I know our contact information was in the beginning of the presentation, and Curt and Tom's is on this page, but feel free to reach out with them with any questions that come up after the fact, or to myself if you have any questions about webinars in general or about DTC and what we do here. Again, my name is Victoria Doda, because I'm not sure if everyone that's on now was on when we introduced ourselves in the beginning. So I work at DTC. I'm a marketing associate here, and then Curt and Tom are from MidAtlantic Transitions. So feel free to reach out to any of us with questions regarding the webinar today.
Yeah, Victoria, thanks again. Thanks a lot for having us. Thank Steve for inviting us. Obviously, sometimes this is a very personal kind of webinar discussion, and if there are people listening and they need to speak to us because it's a personal thing, feel free to call us, email us. We're happy to talk to you, whether you want information about selling or buying. So,
and thank you both for being here and helping us kick off our 2021 webinar series. And just so everyone listening does know, this will be recorded and you'll be able to access it later in the replay. And then we'll have it available on our website at dtctoday.com and on our YouTube as well. But you should get a link for the replay in your email just from Webinar Ninja itself, the platform that we're using to host this. But other than that, thank you all for joining us today, and I hope everyone has a great rest of your Wednesday.
Thanks everyone.
Victoria.
Thank you, Victoria.
Bye, guys.
Bye.